And welcome to our webinar on how nurses can be hospital climate champions. I would like to change that title just a bit and say that this is about how nurses are essential climate champions in your hospital, the essential partner to engage for climate and sustainability solutions. My name is Sarah Spengman. I am the Associate Director for Climate and Health here at Healthcare Without Harm, and this webinar is jointly sponsored by Healthcare Without Harm, the Alliance of Nurses for Healthy Environments, and also Practice Green Health. So I'm going to do a bit of an introduction before we move into our content for today's webinar. Today's speakers are Kara Cook, who is the Climate Change Program Coordinator for the Alliance of Nurses for Healthy Environments, Shanda Demarest, who is a clinical assistant professor at the University of Minnesota School of Nursing and the Nurses Climate Challenge Project Coordinator, and then Jessica LeClaire, who is a clinical instructor with the University of Wisconsin-Madison and also one of our nurse climate champions. So thank you to all of you for being here with us today. As I mentioned, this webinar is jointly sponsored by Healthcare Without Harm, and the Nurses Climate Challenge is a partnership between Healthcare Without Harm and Annie. And our mission is to transform healthcare worldwide so that it reduces its environmental footprint and becomes an anchor for sustainability and a leader in the global movement for environmental health and justice. If you are looking for how to implement climate solutions in your hospital, we hope you will come to us. We also work hand in hand with our sister organization, Practice Green Health. Practice Green Health is the leading membership organization for sustainable healthcare. Our members save more than $1 million annually from initiatives drawn from our sustainability agenda. And many of you on this call today are nurses at Practice Green Health member hospitals. I'm now going to pass it over to our first speaker, Kara Cook, who is going to talk about the Alliance of Nurses for Healthy Environments and our partnership to create the Nurses Climate Challenge. Take it away, Kara.
Hi, everyone. Thanks so much, Sarah. And I just want to thank everyone for joining the webinar today. The Alliance of Nurses for Healthy Environments is so excited to be part of the Nurses Climate Challenge, and we are so grateful for our partnership with Healthcare Without Harm in this. So as Sarah mentioned, I'm with the Alliance of Nurses for Healthy Environments, and a little bit of background into our organization. We are a network of nurses and nursing organizations that are acting at the intersection of human health and the environment to promote healthy people and healthy environments for all. We consist of nurses from a variety of practice settings across the country and even the world, and we focus our efforts around nursing education, research, promoting evidence-based practice, and influencing policy. So before I jump into the Nurses Climate Challenge, I just want to share some information about some upcoming events that you all might be interested in. The first is the Nursing Summit on Environmental Health, and then the Clean Med Conference. So how does climate change relate to nurses? With climate change being the greatest global health threat and nurses making up the largest portion of healthcare providers, there's this imperative to act to address climate change in nursing practice. And we also know that nurses are consistently rated as the #1 most trusted profession, meaning that we really serve as trusted messengers of health information, and we're able to translate complex information in a way that is understandable to the public and our patients. Nurses also have a professional and ethical obligation to address environmental health in nursing practice, and that includes addressing climate change. So with that in mind, in May 2018, Annie and Healthcare Without Harm launched the Nurses Climate Challenge, which is an educational campaign to engage 5,000 health professionals around climate change and health, with nurses leading that education. So what nurses can do is they can visit, and this is just a screenshot of the homepage of the website. You can visit nursesclimatechallenge.org and register to become a Nurse Climate Champion. Once you're registered, Nurse Climate Champions gain access to a comprehensive set of tools and resources to educate and engage your colleagues in climate conversations. The top line goals of the Nurses Climate Challenge is educating 5,000 health professionals on climate change and health. But with that education, we're really aiming to get health professionals talking about climate change, which in turn builds this cohort of informed and engaged health professionals and launches a movement to advance climate solutions within the health sector and within the communities in which we serve. There's some really cool features on the website that you'll see right on the homepage. And the first is this map of the Nurse Climate Champions. This is just a snapshot of the United States, but we have Nurse Climate Champions all over the world. We right now have over 450 Nurse Climate Champions, which represents nurses in 5 continents, 11 countries, and 40 out of the 50 states in the US. So you're able to see which Nurse Climate Champions are in your area, and we're happy to connect you if you'd like to be connected. And then just a quick mention, we still have 10 states in the United States that we're looking to have Nurse Climate Champions in, and we'd love to have that those nurses in place by Clean Med. So I will, once I'm done speaking, I'll enter those states into the chat box, and then I encourage you, if you have colleagues in that area, please encourage them to join the Nurses Climate Challenge. This chart is slightly outdated because we have more Nurse Climate Champions now, but you can see that the challenge can really be utilized by nurses across practice settings. While you see the variety of our nurses are staff nurses, we have champions that are also educators, leaders within their healthcare institutions. We have students who you'll hear from in just a short bit. We have public health nurses, advanced practice nurses, and then researchers. So once you complete your educational session, we ask that you go back into the website to track your education and how many people you're educated. And then this running total displays on the website's tracking tool, which you can see here, and it shows our progress towards our goal. And this, I just updated this morning because yesterday we hit our goal of 5,000 health professionals educated, which is really amazing because this is well before our goal of having it completed by Clean Med this year. So that's really thanks to all of our amazing Nurse Climate Champions who went out there and educated all these health professionals. So with that in mind, we plan to announce a new goal at Clean Med, but we'd like to ask you to help us decide where should we take the next iteration of the Nurses Climate Challenge. So we're going to pop a survey into the chat box and just go in there and let us know what your personal goal is for how you aim to educate on climate and health in 2019.
Me still here? All right, fantastic. So part of this webinar is sharing with everybody on the call about how to use the toolkit in the Nurses Climate Challenge. And we know that several of the folks who have registered are already participating in the Nurses Climate Challenge. Maybe some people are new to it, and so we want to meet all those needs as well. Before I launch into that, I do just want to note, and we've had a really great example of that by Tom Thompson in the chat box, if you have questions, please go ahead and throw them in so that we can see them as we're chatting here, and we will try to address questions while we're talking. And then we'll also have a pretty significant question and answer period at the end. All right, and so with that, the slide that we have here is an image of basically the main toolkit components of the Nurses Climate Challenge. So once somebody creates a registration account through the website, they have access to pieces from how to get started as a Nurse Climate Champion, including pretty detailed steps and a potential timeline for launching an educational session. We have email templates for leadership, for how to engage and how to sort of create that buy-in before you even host an educational session. We have downloadable Word documents to customize to promote your event, whether it's at a hospital or a clinic. Perhaps it might be at a university or in a community setting, and so you can really cater that to what your needs are for your audience members. And then in the middle here, you'll see two little squares about the real meat of the Nurses Climate Challenge, which is the short and the long presentations on the health impacts of climate change. And so each of these little PowerPoint files The shorter version is about 10 minutes long. There are about 8 or 9 slides, and the longer version is just a touch longer than that. But really, we wanted to create this easily digestible, easily communicable education presentation for our nurse climate champions to use for their audiences. And so with that, I'll show you a couple slides in just a couple minutes here. But we have data from the Centers for Disease Control, American Public Health Association, World Health Organization, the National Climate Assessment, et cetera. And so it's really rich in photography and images, and we've tried to make it as simple and as clean to present across audiences as possible. Other components of this toolkit include talking tips for having tough conversations about this contentious topic of climate change, as well as a really important document about a guide for taking action in healthcare or even educational settings at home, either as team members or as an individual. And you can see that PDF in the bottom right. And basically this has a lot of actionable items for people who are new to sustainability and new to climate action, all the way up to people who are, very familiar with this type of action across settings. All right, whoopsie, sorry about that. Okay, so here are a couple screenshots of those toolkit components. On the left, we have that customizable poster that you can use either electronically or printing to educate or to advertise your educational session. So you see here that you can change the date, the time, the location, et cetera, to make it usable for you. And then on the right-hand side, here's just one side of the document about taking action on climate change. And you can see that there are a lot of links throughout. And so for people who are nurse climate champions who are doing that education, who want to learn a little bit more about taking some of these actions, and talking to their audience members about that, they can, follow the link and dig in. We also have heard from a lot of nurse climate champions who have done this education before that the Taking Action Guide is something that a lot of the audience members find really valuable. And so I know that a lot of climate champions have either printed or distributed electronically, because that's something that a lot of people find desirable as the next step after learning about the health impacts of climate change. So I have now a couple slides which are just examples from our presentations on climate and health as part of the toolkit. So what you see right here is a slide essentially that highlights the main areas where healthcare, or a hospital system in this case, contributes to climate change. You'll note that we've included that approximately 10% of US GHG emissions come from healthcare. And in all these little gray pollution clouds, you can see the main areas that we would talk to our audience members about. In the notes section on this slide in the presentation, there are resources and citations for digging into more detail for each of these areas. And so we've really found that this is something that our nurse climate champions, they've spent more time on this slide describing on the front end, okay, here's how healthcare is contributing. Our next sample slide here is one of the examples of health impacts. I did mention that we have the American Public Health Association health impacts highlighted, which is extreme heat, air pollution, severe weather, and vector-borne disease. And then the Nurses Climate Challenge team also found it pretty important to include the mental health impacts. And so we have this slide here. Again, in the notes section of the actual content, there is more information and more resources for how any presenter can learn a little bit more about that before they actually will present it in front of an audience. One way that we have tried to continue to engage the nurse climate champions who have signed up for the challenge, as well as trying to recruit more, is by highlighting nurse climate champions who are doing great work so far across the country. And so you'll see a few examples here. We have examples of nurse educators, students, nurse leadership, staff nurses, in different geographical parts across the United States. And basically this, we're trying to use this as encouragement for people who may not necessarily believe that they're ready to educate people on climate change or that they know enough about environmental sustainability, et cetera. And so we like to highlight folks who are, who have knowledge all across the spectrum, and mostly what they share in common is the passion for nurses to engage about climate and healthcare. And there are a lot of different areas that our Nurse Climate Champions have held educational sessions so far. And so this is one metric that we collect from our Nurse Climate Champions who report education sessions, and we say, how many people did you educate? And that's what Kara was mentioning before. And also, where did you do it? What was the general audience reaction? And so we've had people reporting that they've presented in all types of system settings, green team meetings, which are not just nursing-centric, of course, hospital staff, shared governance, and again, this is not necessarily nursing-focused, leadership meetings, conferences. We've had a lot of engagement across different educational settings, community settings. We've had people do it remotely over webinars and even in break rooms. And the different types of Nurse Climate Champions who have done this education as well, Kara showed that slide a little bit before. We have a very diverse cohort. And you did notice maybe that we have the largest percentage of our Nurse Climate Champions are staff nurses. And so we get really excited about trying to titrate this content to specifically hospital settings. And that's why it's really important that we engage with our partner practice Green Health, because there's that really actionable opportunity to help clinicians take this knowledge and then implement it into practice. And so I wanted to set this up for our next presenter, Jessica LeClaire, who will share her story about being a Nurse Climate Champion in her setting.
Thanks so much,
All right,
Shanda.
Jessica, take it away.
Okay, thanks. Can you hear? Okay, thanks, Shanda and Kara and Sarah, for all of the incredible work you're doing. Your leadership just continues to inspire me to no end, and I'm so happy to share how I'm using the tools that you're providing for us. So just a little bit of background on me. I've been a member of the Alliance of Nurses for Healthy Environments for a couple years now, which is how I first learned about the Nurses Climate Challenge. And I've witnessed the health effects of climate change in Madison for about a decade, and felt that there were very few resources at the time for public health nurses to effectively make a difference. So in 2018, I expanded my practice into academia to educate the future nursing workforce around planetary health issues, including climate change, and all the many different ways that nurses could and should engage around these issues. So this is my first year as a clinical faculty member, and I teach in the traditional BSN, the accelerated BSN, and the DNP programs. So last semester, I introduced the Nurses Climate Challenge in a traditional BSN class called Social Justice in Local and Global Health Settings. Our School of Nursing recently adopted a concept-based curriculum, which is an approach that moves away from subject-specific content and instead emphasizes big ideas that span multiple subject areas. And then we can tie in exemplars that demonstrate how the concept can be applied to multiple issues. So for this class, our concept of the day was the social ecological model, and Nurses Climate Challenge was the exemplar. So these are the learning outcomes that I put together for the day. In essence, we used the social ecological model as an approach to understand and implement the Nurses Climate Challenge. Our School of Nursing is also moving away from solely lecture-based classrooms to more of an active learning approach. So I provided a lot of background reading and resources for the students about the health effects of climate change and the role of nurses to prepare for our in-class activity. And because I'd already been working to educate my colleagues at the Public Health Department about the health effects of climate change, I already had my own slide deck and resources to pick from for the students. However, I do think that the resources on the Nurses Climate Challenge site are excellent, and I totally would have used them and saved time if they were available when I first started this work. And also, the Nurses Climate Challenge makes my job as an instructor that much easier in convincing nursing students that they can do this work. So these are just a couple images from our website to hopefully give you an idea of what active learning looks like at our school. And we feel very fortunate to have these spaces to effectively engage very large groups of students. So this is an outline, this is the outline for our in-class activity. So in class, I provided a brief lecture on communication strategies for health professionals related to climate change, which these strategies were actually put forth by the Center of Climate Change Communication at George Mason University. So they basically had to put together a pitch for bringing the Nurses Climate Challenge to their future places of work as a nurse. These students are in the graduating class of 2019. So in my mind, I was trying to empower them for when they become RNs. But I did have one student, Philip Pape, who is on the call and is going to share his experience with us in a few minutes. He thought, why wait? And took the Nurses Climate Challenge resources to his clinical site and educated his nurse colleagues there as a student nurse. So that really inspired me for my classroom work this semester with the accelerated BSN students. So this semester, I'm teaching a couple courses for the accelerated BSN students that complement each other. They're both called Advanced Concepts in Nursing Practice. One course is didactic, and the other is experiential, or also known as clinical. Having more time between these two courses allowed me to go more in depth with climate change readings and lecture in the didactic class. And just yesterday was the seminar for our experiential class, where half of our class did the same activity as my last semester social justice class, focused on climate adaptation for the Nurses Climate Challenge. And the other half of the class did an activity focused on climate mitigation, where they drafted an imaginary green award proposal for a hospital unit or outpatient clinic. And I got that idea from the University of Plymouth's Nursing and Sustainability website for educators. And my former student, Philip, again, presented just yesterday to these students about his experience with the Nurses Climate Challenge. And then we had another guest speaker who's also on today's call, Tom Thompson, who is the sustainability specialist with one of our local health systems. So both of them supported and helped facilitate the students' activities for that in-class session just yesterday. And just quickly, I want to share another class that I taught last semester for the accelerated students. It was called Health and Illness Across the Lifespan for Individuals, Families, and Communities. And I was able to tie in the health effects of air pollution with vulnerable populations as an exemplar for the concepts of oxygenation, gas exchange, and inflammation. And I will share that Plymouth resource with everyone after the webinar, no problem. Thank you, Gloria. So the students have all received this information extremely well. I've received comments like, we were wondering when our school would discuss climate change. And I actually received my first applause as an instructor in the social justice class after the students completed their Nurses Climate Challenge activity. So I would call that a huge success. They just loved it. And my co-instructor in the social justice class also happens to be our school's diversity and inclusion officer. And she asked me to join the planning committee for our interprofessional equity and diversity lunch and learn series that our school hosts. She was just so inspired by the Nurses Climate Challenge, connecting it with nursing education, that she put together a climate justice panel for one of our lunch and learns this upcoming May and invited me to participate on it. So I'm really looking forward to that and to seeing what further opportunities there are to engage in and further this work at our School of Nursing. We are just getting started. So Now I would like to welcome my former student from last semester, Philip Pape, to share just a little bit about his experience participating in the Nurses Climate Challenge as a student.
Yeah, thank you, Jessica. Can everybody hear me? Um,
We can,
Great.
Philip.
Okay, awesome. Yeah, so thanks, Jessica, and thanks everybody for having me on board for this wonderful webinar discussing some very important and very personal things that we're doing here with the climate challenge. Just kind of given my personal experience with it, as Jessica alluded to earlier. She introduced me to the challenge last fall in her class, and it seemed that the website and the resources and the whole presentation and goal orientation of educating 5,000 health professionals was very straightforward, and I found passion in being a part of this specific movement. So I kind of went out of my way at my clinical site that semester up at Juneau County Health Department, which is just north of the Wisconsin Dells. I was doing rotation there, and I started educating the public health nurses up there. And at first, because this was my first cohort group of nurses I was educating, it was kind of tricky to kind of find an angle and method of communicating with them about the presentation. And I used the Nurses Climate Challenge, the short presentation PDF that you can get from their website. It's very fluid and straightforward and awesome. And so I tried to find ways that I could kind of reach these public health nurses in a personal way, and I found that through the floods that were happening that fall, that were kind of decimating a lot of these lands and a lot of farms and a lot of houses that these public health nurses owned or had association with. And I kind of used that as kind of as a focal catalyst to help kind of get their attention, to kind of have the reel them in, to just kind of listen and hear what I was saying, just because, at the end of the day, I'm a student, but I have uh, these ideas and ways I wanted to convey this nurse climate challenge to them. And this was the best way I found to kind of communicate with them. And I talked about a whole slew of different aspects with regards to why this is important to them, not only from a personal level, but because as a nurse, it says in your code of ethics that that you shall do no harm to your environment. And if it says it right there in your manuscript of like your actual profession, it probably holds some gravity to your stakeholdership of who you are as a person overall. So, it was great to be able to have them listen and kind of make comments about very interesting and specific things that they never would have conceivably thought of or done the research on their own, such as how much water is used for a patient per day. It's obscene, the amount of emissions that occur in the operation rooms in hospitals. They found that one very interesting, and then how another one they found interesting was it costs more money to actually take the waste from hospitals that we get rid of to process and get rid of it from the hospital areas. So certain factoids and certain pieces of education the public health nurses at Juneau County found very interesting and worthwhile to take with them. And it'd be very interesting to reach back out to them and hear if they've contemplated on the information more. And at the end of the day, these presentations and these pieces of education and information we receive from the Nurses Climate Challenge, which is amazing, is how we can change it into our daily behaviors. Because at the end of the day, everything that we talk about, if it's not actually being done on an individual and team effort wise, it doesn't matter. So it's finding ways of how can I reflect on this knowledge and education, and how can I apply it to not only my work life, but my personal life. Because both work life and personal life with regards to decreasing your footprint and reducing your amount of waste that you're contributing, reducing the amount of energy you use, they all apply similarly to both your work life as a nurse or whichever health professional or whatever professional you are. And when you go home, they show great similarities in behaviors wise. So there's a large psychological component to this that we all have to remember is crucial to being able to make small steps over time so that those behaviors become more apparent in the long term rather than try to make a lot of quick changes in the short term, because you'll just burn out and you'll forget that you used a ton of waste that day, or you should have probably recycled that, syringe flush or whatever have you, whatever specific example applies to your work. So
That's
yeah, that's
fabulous.
just kind
Thank
of
you
my
so much.
experience. And yeah, thanks everybody for
Yeah,
listening.
thanks for sharing, Philip.
Yep.
All right, I think we're going to pass it on to Kara now.
Yes, thanks so much, Jessica and Philip, for sharing your stories and really highlighting how the Nurses Climate Challenge can be a starting point for climate action in your nursing practice. So the next couple slides, I'm going to give you some tips for talking about climate change and some different ideas that you can use to incorporate into your educational sessions. So we know that climate change affects countries and regions in the United States differently. So it's really important to include in your education how climate change will impact your region and your local community, which I think Jessica and Philip did a great job of sharing how they have done that in their education sessions. So just a couple of great resources. The Fourth National Climate Assessment came out last year, and this has a really great summary of regional impacts in the United States. And then delving a little bit deeper is another resource called States at Risk, which you can access at statesatrisk.org. And that actually looks at impacts within all of the 50 states in the US. And we include links to those resources as well as a few more in the slide notes and all of the presentations that Shanda mentioned. And that's just another way for you to go in and kind of look at what are some of the regional impacts in your area, and then how can you incorporate that into your education. And then we also know that talking about climate change can be difficult. But in the toolkit, we have tips and tricks for how you can make those difficult conversations easier and effective. So we have in the toolkit, there's a guide with talking points and resources that will really help craft your education sessions in a way that's going to resonate with your audience. So just some top line tips for when you educate others. You really want to emphasize how impacts are personally relevant and affecting human health. You also want to talk about how climate impacts are happening now, not just in the future, and that they're affecting your local communities by providing those local and tangible examples. And then you also want to make sure that you don't overwhelm your audience with too much gloom and doom. We want them to be motivated to take action, not paralyzed. So you want to make sure that you focus on the solutions and benefits of climate action. And just some suggested resources, which we also include on this Talking Points guide, is the Climate Change Communication Resources by EcoAmerica, as well as the climate change resources at both George Mason University and the Yale Program on Climate Change Communication. So I'm going to turn it back to Shannon Demers to talk a little bit more.
Thanks, everybody. And so, as we've heard about all the different opportunities to educate, all the resources we have, hopefully, perhaps there are people on the call who have done that piece but maybe haven't come back and charted or reported your education. And so if you've created an account, we just want to remind you that up at the top, you'll see the screenshot of our website here. There's a link to the activity log, and click on that green button of Submit Activity, and that's where you can choose the date, the topic, the number of people that you've educated, and then you can give us a little more details about what your audience members, what their reaction was, what they thought the next steps might be in their personal setting. And so even though we are at 5,007 exciting health professionals and students educated on climate and health, we're going to keep it going. I tweeted last night, I said it felt like Y2K as I was watching that ticker move down on the front page of the Nurses Climate Challenge, thinking, is this going to explode when we hit 5,000? What's going to happen? What's going to happen? But it keeps tracking. So please keep charting the number of people that you educate. And Tom Thompson asked a great question earlier. He said, hey, I'm a sustainability manager. I'm a leader in that place. I'm not a nurse. Can I still be a climate champion or an ally? And so absolutely, yes. With climate work, the goal is to reduce greenhouse gas emissions, right? That's what we need to do in order to preserve our planet and make it livable for humans and other critters and plants who live here. And so that's why, again, it's important that we have that partnership with Practice Green Health to help translate people who are learning about this in their, in their settings to taking actionable items, taking action on reducing those greenhouse gases in whatever setting they have. So yes, if you are a nurse, if you are an ally, please do create an account. The only difference is if we have people who are non-nurses who have access to the resources, they just don't show up on the map. And not to be exclusive, but the only reason is that we're tracking our specific nurse climate champions and where they are all landing. But we still have all of the content for our sustainability leaders and physicians and public health professionals, et cetera, who are participating. We did just want to share a couple qualitative comments here from some of our champions who have tracked education. And the first comment up here is about some of those specific actionable items that they've done in their hospital. But the second one I want to read out loud because it's really rich. So this nurse climate champion from New York said, "Our nursing leadership is supportive, but other teams have stonewalled nearly every proposal we suggest. However, the more of a consensus we build, the louder our voices will be. Strength in numbers. We plan to continue educating and innovating until they have no choice but to listen to us." And that is absolutely the attitude that we on the team want you to take forward in this work. And it's all about sharing. And so we work really hard to engage with our nurse climate champions at least on a monthly basis. And so if you're getting a lot of emails from Nurses Climate Challenge at healthcarewithoutharm.org, excellent, we're doing it on purpose. And we're also really strategic about elevating the successes and elevating our nurse climate champions on social media as well. So we're on Twitter at RNClimateChow. So use the hashtag Nurses Climate Challenge. We're always doing shout outs to Healthcare Without Harm and Annie, who are the co-sponsors. So if you educate, use these hashtags, include us in your social media posts so that we can help be excited about your success as well. And then we are working on our Instagram profile, and so we have some photos up there that we've pulled from our website, but also from action in the healthcare setting as well. So if you have images that relate to this, share them with us and we can get them on our Instagram page. Okay, I'm going to take a pause and transition just a little bit to another very closely related initiative related to nursing and climate. And a lot of the same team members who are working on the Nurses Climate Challenge are participating in this initiative too. So I want to tell you about the CHANT, the Climate Health and Nursing Tool. And so this is a survey that's been developed by Kara Cook, Beth Schenk, and myself about nurses' perceptions, understanding of motivation, behaviors around climate and health. And so we've worked really hard over the past year to create our first iteration, and we've worked to evaluate that for validity and reliability. And now we have a fresh new version of the CHANT survey. We have the link here at the bottom, and we also have the screenshot of where it lands on the Annie website. So please, if you've already taken it, come back, take it again. And share it with all of the nurses that you know. We want to get outside the green choir, right? We want to get outside and get understanding of how nurses who are not necessarily super savvy with climate and environmental sustainability, like probably many of you are. We want to hear, what do nurses really think and know and care about and do in their settings? And finally, we want to give a really important shout out right now about an opportunity to elevate some super successful nurse climate champions, environmental sustainability champions, et cetera, coming up at the Annie Summit and Clean Med Nashville. And so I want to just introduce the Charlotte Brody Award, which is a longstanding award provided by Healthcare Without Harm and Alliance of Nurses for Healthy Environments. And so if you know people who are doing great work across settings, and when I say people, I mean nurses, this one is nursing exclusive, nominate that person, nominate yourself. And we're asking for submissions by March 1st, which is just around the corner. And so check out this link at the bottom here, cleanmed.org/Charlotte Brody Award. And it's a pretty simple application, and we have Some great examples of winners in the past, such as Katie Huffling out of Alliance of Nurses for Healthy Environments, and Beth Shank and Joyce Stein. So the movers and the shakers, we want to know who else is coming up hot behind them. And with that, I'm going to pass it back to Sarah Spengeman.
Hello, thank you so much, Shanda. And we wanted to do just another quick reminder about our upcoming events. CleanMed Nashville has a great lineup of expert speakers around climate and health, and 2 sessions that are led by nurses. And then, of course, as Kara mentioned, the Nursing Summit on Environmental Health is held just prior to CleanMed Nashville. So we're really looking forward to connecting with everybody in person. We also have an exciting way to promote the Nurses Climate Challenge to help educate people about climate and health, and also to recruit new nurse climate champions. At CleanMed, we are going to be showing a compilation video of videos that you make highlighting the challenge. These will be shared also throughout the year on social media, on Healthcare Without Harbs channels, on Annie's channels, and on the Nurses Climate Challenge channels. And we would like every single person on this call who's a nurse climate champion to help us make a video. If you registered for this call, you're going to receive a 1-page guidance for making a quick selfie video. It's super easy, and I'm going to quickly play the audio of Shanda's video, which she created as an example. And we tried to play the actual video itself, but we had a problem with the technical side of that. So you're going to hear the audio of the video. So I invite you to listen, and then I will share the link so you can view it on Twitter. So, all right, I'm going to play it now.
I live and work in Minneapolis, Minnesota. I have been a cardiovascular nurse for almost 6 years at Abbott Northwestern Hospital. And in the last couple years, I've served as a clinical assistant professor at the University of Minnesota School of Nursing. I'm a nurse climate champion because in my role as a cardiac nurse, I've seen firsthand all of the patients here, even in Minneapolis, Minnesota, who during the summer months are seeing worsening in conditions like heart failure, COPD, asthma, because we have really hot, muggy weather here in Minneapolis. And I've also seen some of the climate impacts of things like snow and ice and outdoor winter temperatures that also make it tougher for people who have cardiac conditions or histories of heart disease to get out and shovel and be safe outside. Also, as a nurse, I've noticed that we use a lot of supplies and a lot of energy and a lot of resources, and we create a lot of waste as part of our job. And so I joined up with Healthcare Without Harm and Alliance of Nurses for Healthy Environments to build the Nurses Climate Challenge, to rally my fellow nurses and my nurse allies around the country and really around the world to take what they know from practice and have an impact about how to reduce the nursing and the healthcare contribution to climate change. And so I'm reaching out today to really encourage all of you to dig in and participate in the Nurses Climate Challenge, educate your colleagues, educate patients about why climate change is dangerous for humans and what we can do together to make a change. So we're looking to get 5,000 health professionals educated by May 2019, a couple months away. Help us get there. Thanks, folks. Hi, everyone.
Oops, sorry, almost replayed it for you, but hey, I gotta say, it's worth watching over and over again. So thank you, Shanda, for making that video. And we hope all of you will consider making a very similar video to feature on social media and be shared at CleanMed. So watch for selfie video guidance to come with the recording of this webinar. Now we would like to open it up for folks to both share their own experience using the resources, any challenges you've had delivering presentations, any ideas you'd like to share, as well as any questions you might have about using the resources. If you want to chat your question into the chat box, that works, and I'll read it out to our panelists. The other way is if you hover over your name on the sidebar, you'll see a little hand, and if you click on that hand, it will show that you are asking a question. So then I can unmute you and we can hear directly from you. So we do have one question already that I am going to set up for the panelists, and that is, how are nurses working in conjunction with their health systems that may already have specific energy and carbon reduction goals and initiatives in place? And I'm going to unmute all of our panelists. I'm also going to unmute Julie Moyle, who is a member engagement manager and who works directly with the sustainability leads at many of our hospitals. So Julie, feel free to chime in as well. We love to hear what you have to say about this. And Kara, you are also, and Shanda, you are also on mute, so feel free to jump in, and I'll continue to field the questions.
Well, thank you. Hey, this is Julie. I'm happy to jump in and start the conversation about how nurses are helping their hospitals address and achieve their greenhouse gas reduction goals. And I think there are a few things. One is just, demonstrating by example, just changing something that you are doing in your practice, whether it's recycling or, segregating waste or whatever it may be, that actually kind of forces others to stop and observe the difference and for them to adjust, how they're going to respond. So I think the most powerful way that nurses are helping their hospitals is by, walking the walk and, insisting on recycling, on safer chemicals, on, products that don't harm patients or pose risks to staff, let alone, the connection to the environment. And that leads me to my second point, which is, we are an empirically based practice. We always have been. And so the science is there. And really, because we now are so aware of how the environment does impact health, it's almost moved our practice, my practice personally, to one of advocacy, which, in my mind is kind of the highest form of practice, right? Because you're increasing scale and scope in terms of not only preventing, disease, but promoting wellness in your community. And that's what we do. So for me, it's, about more than the patient. In my case, I'm in the operating room, but it's more about the patient on the table or the patient in the bed. It's about, our community and providing healthcare outside the four walls of the hospital. So those are three ways that I see, nurses really playing a significant leadership role in this kind of advocacy and helping guide our hospitals to really, and our colleagues, to fulfilling that mission and that oath that we swore to take.
Thank you, Julie. I think that really helped answer the question. So I think we can move on to another question. So thank you so much. We have another question. I'm going to unmute Giatti, it looks like, and go ahead and say your question.
Oh, hi, this is Jyoti. Can you guys hear me?
We can.
Oh, thank you so much for taking my call. I have a couple of questions. First, I wanted to know, what are the other organizations similar to yourself, not just helping nurses, but also healthcare professionals in general? And my second question is, have you guys watched this documentary called Cowspiracy? I heard it's a very moving documentary. It's about the impact of animal farming and climate change.
That's great. Thank you so much, Jody. And Shanda, I'm wondering if you could say a bit about I know that Cowspiracy focuses on the greenhouse gas impact of animal agriculture. And Shanda, I'm wondering if you can say a bit about the suggested actions in your hospital and in your home that we offer to Nurse Climate Champions to also share with their fellow health professionals. I think that's one thing we could touch on. And then Kara, maybe you could just say a bit more about Annie too, as well, to help answer the question about other organizations.
Yeah, absolutely. You bet. So Shanda here. Thank you so much for that question. And one specific action item that we offer on that tips for taking action document is Healthcare Without Harm's program, Less Meat, Better Meat. And I also would like to say no meat, right? No meat or no animal product probably is the most environmentally sustainable way to go. We also know that that's really culturally challenging for individuals. And so being realistic and saying in healthcare systems, we provide a lot of food for patients at the bedside, right? We have cafeterias, we have different food companies coming in and providing, meals and that type of thing for visitors. And so by nurses, first of all, understanding the implications that animal-based diets has on the environment, which is what you're talking about, and then understanding how, okay, by consuming fewer animal products, less meat, that will not only reduce, the environmental impact of producing that, those calories in the first place, but then also shipping them from these agricultural systems wherever they are. So first of all, the environment piece, but then also that has a lot of health co-benefits for others as well. And so we highlight that because when we're talking about patient health, it's nice if we can really emphasize the twofers. And then before I kick it back to Kara, I do want to also just highlight a really fantastic health professional group that's doing this type of work out of Healthcare Without Harm, and that's the Physician Sustainability Organization with Amy Collins. And so she has really done a lot of phenomenal work rallying docs around this as well. And we partner a lot, we share a lot of resources together, and we really try not to duplicate efforts. And so we would be remiss if we didn't, mention the Physician Sustainability Network. So with that, Kara, I will kick it back to you.
Yeah, thanks, Shanda. There are many health professional focused organizations that are working around climate change and health, and we all work closely together because we understand that this needs to be a movement. It's just not one profession on its own. So some ideas for physician focused organizations: the Medical Consortium on Climate Change and Health has a number of medical societies that are member organizations and have made a commitment to addressing climate change. For nurses, we have the Nursing Collaborative on Climate Change and Health, which includes ANI, as well as 9 other nursing organizations that are signed up as members. There's also, for public health professionals, there is the American Public Health Association, which has done a ton of work on climate change and health, and they have a lot of really great resources. And then the American Lung Association is really focused around air pollution and how climate change impacts air pollution. So they have some really strong resources around climate and health.
Thank you, Kara. And thank you so much, Shanda, for mentioning Healthcare Without Harm's Physician Network. I popped in the link on our website to that initiative, and please share that initiative with all of your physician colleagues. It's got a wonderful set of resources, and it's a great network to help create and support physician sustainability champions. So thank you so much, Shanda. We do have a question from Allison Kirby. Allison, I'm going to unmute you as well.
Hi, everyone. Can you hear me?
We can.
Hi. Sorry. That question that was addressed first was actually my question, so it was already covered.
Wonderful.
So I'm all good. Thank you, though.
Thank you, Allison. All right. Any other questions? I'm going to also call on a nurse that we have on the line from Memorial Sloan Kettering, who was also going to share just a couple of tips for how she's been using the Nurses Climate Challenge at their hospital. Katie, can you hear us?
Yes, can everybody hear me?
We can hear you. We'd love to hear your suggestions and tips.
Sure. So we've formed our sustainability committee on our unit, I'm going to say about 2 years ago. And when I got introduced to the Nurses Climate Challenge, that definitely helped us form, I guess, a guide to speak to our other nurses on our floor about different issues, whether it was recycling or saving energy, reducing waste, with the help of our sustainability director. We are fortunate at our hospital to have such strong support from our sustainability department, and they helped us kind of do an in-service with the nurses on our floor on just specific ways we could cut down on waste or like save energy on our unit. So the Nurses Climate Challenge was very helpful, and especially the slides and the links.
Thank you so much for sharing.
Yeah.
That's great. We do have another question from Hannah Noel Bouchard, and she is asking, what about school nurses? I had first thought maybe she meant nursing schools, but she means actually the nurses at your elementary school or at your high school. She says she is a school nurse and she would like to use the Nurses Climate Challenge to present to other school nurses. Shanda or Kara, what would you say to that?
Yeah, so I think that would be amazing to get this presented to school nurses. So just some thoughts. I don't know if you're able to connect with any school nurses in the area, because that would be a great starting point in holding an educational session like that. If not, I would recommend reaching out to, and I'm happy to help you with this, to the National Association of School Nurses. They have been very on board with environmental health issues and school nurses and providing resources. So that would be a good opportunity to connect with them and see if there's an opportunity to either present in your community or even to present at their national conference on this information.
That's great.
Great, thanks, Kara. And one thing that I just keep hearing, with every question, every answer is connection. And so much of this is about finding your people. And, we can create as many tools and resources as we possibly can, but the point is, if there aren't audience members, if there aren't people to hear it, if there aren't nurses, with that passion moving forward to do the work, it's for nothing, right? And so that's why we're all together on this call today, trying to find others doing the work and to learn more about how, we can move it forward.
And I saw someone actually reach out and say that they are also a school nurse, Hannah. And so, Hannah, I am going to connect you to Gloria, who's also a school nurse, and you guys can strategize together. So that's what we love about this challenge, is building connections. Are there anyone else who have questions or would like to offer tips or strategies? Stacy is asking, what would you recommend for a nurse just starting out in the field?
That's a great question. I think number one is take a look at that first document of the steps and timeline, and that gives an idea of what the specific resources are that you could use for an educational session. And the number one step is find out who your leaders are and find out sort of what makes them tick. What type of information do they need from you in order to buy into that climate and health education? Because as a staff nurse who's just entering the field, it's important that you find those allies who have, maybe the person who has the golden key, who has the access to the audience members. And so starting with building that relationship with the person who can help you get there.
And I'll just add to that, always feel free to reach out to us as a resource for you. Maybe there isn't someone that's within your health system that you feel comfortable talking to, but we're happy to connect you with nurses who have been doing this work across the country, or maybe even someone near you, so you can kind of have that support system, because it can be a little intimidating and overwhelming to get started, but know that nurses have done it and will continue to do it, and we're happy to connect you to help kind of share those ideas and resources with you.
Kara, that is a great way to end, and I just want to remind everybody to take our survey to help us create our next ambitious goal for educating health professionals, and also to feel free to reach out to Nurses Climate Challenge at healthcarewithoutharm.hcwh.org, and we are happy to continue to answer your questions. So thank you, everybody. Thank you, everyone, for participating today, and go forth. Thank you.